Hi, my name is Dan Bartholomew. I'm a physical therapist in the Outpatient Physical Therapy Clinic here at Sharp Grossmont Hospital. Today, I'm going to talk about exercises to help improve knee extension range of motion. Every knee problem is different and requires a specific approach. So when performing knee exercises, it's always a good idea to consult your physical therapist or doctor to see if those exercises are right for you. Knee extension is your ability to fully straighten your knee when you're standing and walking, which is very important because when your knee is not fully extended, it can create pressure through your hip and your back. The first exercise we're going to go through is a stretch to help improve your knee extension. One helpful tip is if you're wondering if you're lacking knee extension, sit in this position that Mark's in right now, and if you look at your knees and one knee is higher than the other, that knee is lacking knee extension, and that's the one you need to work on. With this stretch, we're going to be stretching the calf. Some of the calf muscles insert above the knee. So if those muscles are tight, they can keep your knee bent and limit knee extension. For this stretch, Mark is going to use a strap. He's going to wrap it around the ball of his foot here and pull gently back on his foot to feel a stretch in his calf and the back of the knee. There shouldn't be any pain felt in the knee joint itself. Another tip is you don't want to lift your foot up off the table. You want to keep it rested on the table and provide a nice firm stretch with the strap. Also, if you want to intensify the stretch, you can put the strap in one hand, use your other hand to apply pressure on your thigh and push down gently. And I repeat, gently. If you push down too aggressively, you can cause increased knee pain. You're going to want to hold this stretch for 30 seconds and repeat it 2 to 3 times, 2 different sessions a day. In this exercise, we're going to work on the patient's ability to actively straighten their knee. So with this exercise, Mark is going to be leaning back against the wall. He's going to have his back and his hips firmly planted against the wall and his foot approximately 6 inches away from the wall. He's going to place the ball behind the knee and he's going to activate the muscle in the front of his thigh, his quad, to straighten the knee to a comfortable position. He's going to hold that position for 3 seconds and then relax. So that exercise should be repeated for approximately 2 sets of 10, once or twice a day. And like the other exercise, should be performed pain-free.